Come with me on a day in my life as an anesthesiologist assistant working 13-hour shifts. On this day, I was assigned to be in an orthopedic surgery room, and so the surgeries were for the lower extremities, so people were getting knee replacements, they were getting hip replacements, they were getting revisions for hardware, and they were also having hardware placed. So it was a really busy day. I was in 5 surgeries. These are big surgeries, so they can take longer. Orthopedic surgeries can have multiple anesthetic types depending on the surgery, depending on the surgeon's preference. For example, sometimes we do orthopedic surgeries with a spinal, and so we numb up the lower extremities of the patient with the spinal, and then they get sedation in their IV. Or we can do it with general anesthesia. The anesthetic plan on this day was for general anesthesia, and so I prepared many medications to administer through the patient's IV. Once they were under anesthesia, they were maintained under anesthesia through breathing devices, whether they were something called an LMA or an endotracheal tube, and they breathed in the anesthesia. At the end of the surgery, the patients breathed off the anesthesia and the breathing devices were removed. So it was a super busy day, but I had an amazing team that I was working with that day, so the day went by and it was an amazing day overall. So catch up with me in the next one.